There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what causes heart flutterings in high blood pressure? Answer by Bethany Duran. There's a number of factors that can cause the sensation of palpitations or heart fluttering. But classically, when we hear that as cardiologists in the setting of high blood pressure, we worry about an arrhythmia, which is basically an abnormal heart rhythm that comes from somewhere other than the normal pacemaker in your heart, sinus node. This can arise from high blood pressure. Basically just causes the heart to squeeze against a lot more resistance, because the heart is connected to the aorta, which connects to the arteries in your arm where we measure blood pressure. We use blood pressure to tell us the pressure the heart is beating against. If your blood pressure, the pressure the heart is squeezing against, is high, it can cause the heart to get larger, hypertrophy, or to enlarge, dilate, and can also cause the top parts of the heart to grow larger, which is how abnormal heart rhythms happen. Sometimes your heart just is skipping a beat as well, which can cause the sensation of palpitations. We talk to a physician if these are persistent. You might need a Holter monitor and would at the very least get an EKG. If it happens a lot or you're really symptomatic, can also consider an ultrasound of your heart to make sure the structure is okay. Answer by Teresa Crum. It doesn't. If you have high blood pressure, you need to get that checked out at the doctor's office. You may need to get on a medication to bring your blood pressure down. High blood pressure is the silent killer. I have a prolapsed mitral valve, which is common, 10% of the population, so I used to occasionally feel it. It can cause one to have PVCs, premature ventricular contractions, which are benign, for the most part. I hooked myself up to the monitor while at work, and I could see them. It happened whenever I thought about my ex-husband, so certainly there is a mind-body connection there. Back to the high blood pressure issue. High blood pressure can wreak havoc on all your other organs. As you age, you may develop higher blood pressure, so you really need to see your doctor. The medication which I take now has no side effects and works well, and I have no anxiety about it.